Hi, my name is Isabelle Saenz, and I'm a senior nursing student at Bethel College. So I did my research over family members' presence during cardiopulmonary resuscitation, or CPR, and how this could be a change of practice in the medical field today. So first, I'm going to start with my research question. So my research aimed at looking at patients regaining ROSC, which is return of spontaneous circulation, more often if their family is in the room than if the family is not in the room during CPR. And then also, if there was enough research, I would look at, do patients believe their care during CPR was improved or more positive due to their family being there for them? So the background, the reason that I started to look at this research topic is because I was reading about CPR, and if CPR is begun while family members are present, it is very common in today's practice to have them ushered out of the rooms due to uncertainty around the safety during resuscitation. I did my capstone in the ICU, and so I see this a lot with when we start CPR on a patient, the family members are automatically ushered out of the room. And so I wondered how, if we allowed the family to be present, whether that would change the outcome of the patient living or dying, or how well the patient did after they lived, if they did. So this started with the debate between family being present during CPR started in the 1980s with a Mississippi hospital patient and their family. And that is when the debate started on healthcare workers deciding whether to let the family be present or not be present. So there's some main questions that do drive this research. Is it beneficial to both the patient and the family members to allow family to be present during CPR? And what is that benefit? How do healthcare providers decide whether our patients and family members are obligated to have family members present during CPR? And when is it a good time to have them present and when it is not? And other circumstances. And then, is harm truly being prevented by keeping the family out of the room? So does research show that not having the family in the room does increase the likelihood that the patient regains ROSC, or that the healthcare workers and the patient are remain safe? And then, is it the patient's medical right to have their family members present if that's what they wish, and if they've stated that's what they wish? So the literature review, I'm going to start with that. It looked a lot at how the family viewed being present during the patient's CPR, and a lot less how the patient reacted and the patient's state after the family was present. But with there was little research on patients regaining ROSC, or a return of spontaneous circulation after CPR with family present. So the minimal research that I did find was there was no difference in resuscitation duration or mortality when comparing family presence during resuscitation and not having family present. However, they did find that this doesn't worsen the mortality rate or the quality of resuscitation. It just doesn't improve it either. This couple articles that I found, they did state that this was very minimal research, and that the likelihood that this could be different with more research to come, that could be the case. So another part of the literature that I found was patients' view of their care when family members are present during CPR. This was also minimal research found, just because only 50% of patients that receive CPR, they live. That there's only 50% of them do. So this article did state that patients were relieved and felt comfortable with the fact that family members could act as advocates during resuscitation. And family presence was comforting to the patients, and they benefited when their families prayed, talked to them, and kept them calm. So whether they regained ROSC or not, or a return of spontaneous circulation, the patients did feel relieved and more calm when their family members were present, from the research that we did find. So another part of the literature review was the family's view on being present during the patient's CPR. And this was the biggest chunk that I did find, even though this wasn't the first aim at the research topic, but this is the majority of what the research has been done on. So it showed that PTSD rates and depression anxiety rates were significantly higher in those that did not get to witness the CPR of their family member. And then also there was a section of research that talked about the not allowing family presence during CPR, why that is, and different aspects of that. So that showed that CPR is denied due to the notion that negative outcomes of CPR happen, such as family members getting in the way, medicine errors because the healthcare workers are stressed or distracted by the family, stress from the healthcare workers because of the way the family's acting or feeling like they need to do everything they can and just being stressed. But however, the research did show that having family members present during CPR didn't result in any negative outcomes for the patient or the family. And in some instances, it did show that healthcare workers felt a sense of not trying harder, but a sense of urgency to actually really save this person at their hands. So there's a couple cues and competencies that this research topic would fall under. And this, one of them being patient-centered care. So the patient-centered care competency focuses on understanding that patients deserve care that is respectful of what they want or need, all while being compassionate. So, as evidence showed in my research, family presence during resuscitation has no negative effects. Therefore, patient-centered care promotes allowing patients and families to make this decision on whether they want their family to be present during CPR. So this QSIN competency would support that that's the family's right and the patient's right to have their family present, since evidence has shown that having family members present during CPR doesn't result in negative outcomes for the patient. And then another QSIN competency that this research topic falls under is evidence-based practice. So evidence-based practice means to integrate best current evidence with clinical practice and patient family preferences to give the most optimal health care. So we can look at family presence during resuscitation and decide whether it matches up with the best current evidence and family patient preferences. So it's important to look at the research and back up healthcare with what the research shows, because that's what best practice is. This shows that there's evidence and there's something to back up the way that medicine is provided. And I feel that a change of practice would be perfect in this sense, because evidence does show that there's no negative effects to have family presence during CPR. There's no negative effects at all, even though this research topic was aimed at families' presence during CPR and how that helps patients regain ROSC more often, which evidence showed that there's no change in that. It did show that there are no negative outcomes during CPR for family or patient, and it actually does help the family of the patient in the long run with PTSD, anxiety, depression, and stuff from losing their family member. So this is a perfect instance of when evidence-based practice allows practices to change in healthcare due to research that has been shown. So my recommendations, obviously the first one is more studies and research done, specifically to the instances of patients regaining ROSC while having family members present. This is just minimal research has been done on this specific of a question. And so in order to really see whether it does affect patients regaining ROSC or not, I think more research definitely needs to be done on that aspect. And then another recommendation is, if more and more healthcare workers would allow family members to be present during CPR. There should be guidelines for allowing family members to be present. There should be guidelines such as being in the corner or not being in the way, and proper behavior and stuff, just to keep the healthcare workers safe and the patients safe and the family members safe. There should also, in my recommendation, should be a designated family support or advocate person to be there for them. So this person would help them tell the healthcare workers, like, yes, I should be allowed to be in there during CPR, let me be in there. It would also help keep the family not in line, but calm and relaxed, and allow the healthcare workers to do their job safely and effectively without the family members getting in the way. And this person could be one of the nurses that's working with this patient. It could be the nurse manager on the floor. It could be anybody, but there should be a designated family support person that is decided when the CPR process begins, just to make sure that family does get to be present, but it's still a safe environment for everybody. And then another recommendation is just education for healthcare personnel and the public, to let them know that research does show that there's no negative effects of having family members present during CPR. In the place that I capstone, in the ICU, this is still the norm, is to rush family members out of the room. That's an expected thing that for you to do as a nurse, is if CPR has begun, the family is automatically taken out of the room without question on whether they want to stay or they want to go. And so I think education is just super, super important in this aspect, just to let everyone know, even healthcare workers, that they don't have to usher them out if the family is, if that's the family wishes to have them present, that's their right, and that's the patient's right. And also, if there's no negative outcomes coming from family members being present during CPR, then they should be allowed to stay, barring that everyone's safe and every CPR is being competently done for the patient. So in conclusion, I've stated plenty of times that not enough research to support my PICO question is present, but evidence does show there are not negative outcomes or effects of having family members present, which is important. And better physiological outcomes for family members is a huge thing in allowing family members to be present during the CPR if they do choose. And then patients also feel calmer and more reassured from the minimal research that was done, that when their family members are present. And this is, even though this doesn't always lead to more instances of regained ROSC or return of spontaneous circulation, then but it still does help them stay calm. So the whole basis of this research question, the majority of what it comes down to is there needs to be more research done. It's hard to do, and only 50% of patients that receive CPR live. And so it's hard to decide whether healthcare is better for a patient once they live from ROSC. It's a bit subjective. So just a little bit more research needs to be done, and allow family members to be present, and for them to know their right, that they're allowed to be present, and patients to know their right, that they should be able to have their family present during that very scary and very intimate part, an important part of their life. Thank you.